This lecture will be all about transducers, a lesson on basic physics of transducers, how they're made, and the components of a transducer, as well as different applications and types of transducers. A transducer is used to obtain an image of the human body using ultrasound. It is often referred to as a probe or an ultrasound probe. The transducer can convert energy from one form to another, and for diagnostic ultrasound, the transducer converts electrical energy to mechanical or sound energy and vice versa. Transducers can come in many shapes and sizes, and these are created for explicit reasons for specific examinations. The transducer is truly the heart of the ultrasound system and is what is used to create the image. As you can see here, there is a wide variety of different transducers that can be used for different scanning applications and different exams. As far as the transducer function, the transducer operates using the pulse echo principle. Within the transducer, there is a crystal that produces the ultrasound wave once pulsed with electricity. That wave is then sent into the body and returns back to the transducer. The strength of this echo is then displayed on the system's monitor. Here are some components of an ultrasound transducer that will be briefly discussed on the next few slides. Transducers will be more heavily covered in the ultrasound physics course. First, the electrical cable provides the electrical connection from the electrical power source to the active element. The transducer has a protective case, usually made of plastic, that covers the transducer components. This helps protect the internal components of the transducer and also insulates the patient from electrical shock. The protective case is often marked by a groove, dimple, or light for transducer orientation so that the sonographer is always able to maintain that in the correct position. The transducer is also always labeled in reference to configuration and frequency, and this can be found on the transducer as well. The damping material, or also known as the backing material, is located behind the active element of the transducer. The damping material's job is to quench the vibrations, which will help shorten the ultrasound pulse. With a shortened ultrasound pulse, this will help to improve axial resolution and also increase the bandwidth of frequencies. The crystal is the active element within the transducer, and it can also be known as the piezoelectric element. The active element in the transducer may be a naturally occurring material, or it can be synthetic or man-made. The piezoelectric effect occurs when voltage is applied to certain crystals. The crystal will contract and expand, producing a mechanical wave, which is the acoustic beam. When a mechanical wave or the echo strikes the crystal, it causes the crystal to contract and expand and then converts the mechanical energy to electrical energy. These are some types of crystal materials: natural, quartz, tourmaline, and Rochelle salt, and synthetic or man-made materials, lithium sulfite, barium titanate, and lead zirconate titanate, or commonly known as PZT. And PZT is the most commonly used crystal material that is found in ultrasound transducers. Synthetic materials are often preferred in ultrasound transducer construction for numerous reasons. So they have a lower cost, they're readily available, they tend to be more durable and can be consistently reproduced, and they're more efficient in the conversion of acoustic energy to electrical energy. The shape and size of the crystal within the ultrasound transducer can affect the ultrasound image. So as far as crystal diameter, the diameter of the crystal affects lateral resolution. The smaller the crystal diameter, there will be better lateral resolution, and the larger the crystal diameter, there will be poorer lateral resolution. The thickness of the crystal affects transducer frequency. So the thinner the crystal, the greater or the higher the frequency, and the thicker the crystal, the lower that the frequency of the transducer will be. Propagation speed is how fast the beam can travel through a particular medium, such as soft tissue, bone, or fluid. Propagation speed of the crystal has a direct relationship with frequency. So the faster the propagation speed, the higher the frequency. Here's an image showing the size of a single crystal within an ultrasound probe. It is about the size of a human hair, so very, very small. And ultrasound transducers are composed of numerous different crystals that make up the transducer. The ultrasound probe also has a matching layer, which is also known as a quarter wave layer, because the thickness of this layer is 1/4 or a quarter of the wavelength. It is the material in front of the active element, and it helps reduce impedance between the crystal and the skin to increase sound transmission. Without the matching layer, much of the sound waves trying to enter the body would be just reflected on the skin. There are many types of transducers. First one is going to be a mechanical transducer, which is a single element that oscillates or rotates within the probe. This type of transducer actually has rotating or moving parts within it. An annular array consists of rings of elements within the transducer. And then most modern transducers nowadays are electronic, which have multiple elements in an array. Here's an image showing different transducer configurations. So the first one here is a phased array, or often known as a sector or a vector. They tend to have a small footprint and kind of a pie-shaped image. The next one is a linear array, and this one actually has a wide scan on, but typically a linear array will be more of a box or a rectangle type shape. So you can see the sound beam coming off here is more of that rectangle shape. And then a convex array typically has a wider face and comes off in more of like a fan. And this is often used for abdominal type of scanning. A linear array produces a rectangular image and provides a large field of view. It produces images with good resolution and shallow penetration. So there's always going to be a trade-off with resolution and penetration. Typically used for small parts, vascular and pediatric imaging, anything superficial. And the typical megahertz is between 14 and 5 megahertz. Here's an image using a linear array for a thyroid scan. So you can see that the image shape is rectangular. We're not imaging very deep, but with this type of probe, we have very nice resolution. The image is crisp and we're able to see a lot of detail within the thyroid. With a vector transducer, this will produce more of a trapezoidal image and is a type of phased array. So with this transducer, it has a smaller footprint and allows for more transducer manipulation. It can be great for abdominal scanning, OBGYN scanning, and even pediatric patients. And the typical megahertz is 6 to 2. So it has a much lower megahertz or frequency, and therefore you are going to lose a little bit of that detail or resolution as well with this type of probe. So you can see with this probe, it has a very small face on it, which can be great to use to get in between the ribs or on pediatric patients, but it still produces a very wide field of view and it also has good penetration, but the resolution maybe wouldn't be as crisp as something with a higher megahertz or frequency. Another type of phased array would be a sector transducer, and this type of transducer produces a pie-shaped image. It again has a very small footprint and allows for really great transducer manipulation. This is a typical probe that's going to be used for cardiac imaging. It can also be used for abdominal, OB/GYN, and even transcranial imaging. And the typical megahertz for this is 6 to 2 as well. So on this image, we can see the very small footprint at the top, which gives us a very small near field. And then the transducer fans out into a pie-shaped image, giving us a very large far field. This is great for cardiac imaging because of the narrow footprint, allows us to get in between the ribs or those tight spaces in order to still be able to image the heart. A curvilinear probe produces a large convex near field with a blunted sector image. So this transducer has a large footprint. It's going to be used most for abdominal and OB/GYN scanning. These transducers have a lower frequency for deeper penetration to image deeper structures throughout the abdominal or pelvic cavities. And the typical frequency or megahertz on these transducers is 5 to 1. So very low frequency, which allows for that penetration, but we lose resolution with this type of transducer. So here you can see on the curvilinear probe, it has a very large near field and face of the transducer. So this probe, you could struggle to get in between the ribs or other things because the face of the transducer is so large, but it's great for abdominal or pelvic scanning with these large structures such as the liver. You're able to get them all in one view of your probe. Again, these probes typically operate at a lower frequency, which gives us great penetration to image those deeper structures, but with that we lose resolution as opposed to using something like a linear probe. So this is an image showing different transducers and their faces in order to scan through structures such as the ribs. So for example, this first one is a sector transducer, which is often used for cardiac imaging. Up by the heart, we have ribs there that we have to work around. We're not able to see through the ribs. So as you can see, this transducer face is very small and can fit in between the ribs. It has a very narrow near field, and then the far field fans out, so we are able to see structures deeper to that. With the linear probe, as you can see, the face of the transducer is bigger. So if we were to try to scan in the same area, we would be hitting the ribs and getting rib shadows through each side of our image and really only seeing this middle section. With a curvilinear probe, we have a very large face where we're actually seeing, on the outside of the ribs and on the inside of the ribs, but we have this large rib shadows going down through the center of our image. So this just goes to show that a sector transducer is great for tight spaces such as getting in between the ribs. You'll always want to choose your probe based off of the structure that you're scanning. A mechanical 3D probe is a large transducer that acquires three-dimensional volume information to produce a four-dimensional image. So that fourth dimension is motion or movement. This is typically going to be used mostly for OB scanning to get those pretty 3D pictures that we all know. And the typical megahertz or frequency on these probes is 6 to 2. Here are some cute three-dimensional images that are created with the use of that mechanical 3D probe, and these are most commonly going to be used for obstetrical scanning. Endocavitary transducers are designed to be inserted into a patient's rectum, vagina, or esophagus to improve image quality of internal structures by reducing the distance between the transducer and the structure. By using these endocavitary probes, we can get an up-close view of the different structures that we're trying to image. The probe on top is going to be used for transvaginal or transrectal scanning, and the probe on the bottom is going to be used for transesophageal scanning for imaging of the heart. An endorectal probe is typically 5 to 8 megahertz and is used to evaluate the male prostate and the rectal wall. A transvaginal probe is also 5 to 8 megahertz. Oftentimes they are the same probe, and it can be used to evaluate the uterus, endometrium, ovaries, embryo, and fetus. A transesophageal probe, or often abbreviated TEE, is typically around 3 to 7 megahertz. It is used to examine the heart in more detail by entering through the patient's esophagus. The probe tip can actually be flexed, extended, and angled left or right using dials on the probe handle. When choosing a transducer, there are numerous different factors that are going to influence your selection. First of all, the anatomy to be imaged. Is it a superficial or a deep structure? Second, the body habitus of the patient. Is it a pediatric patient or is it a patient that is obese? That is going to make a difference in your probe. And also the examination objectives. Think about something like the liver. For the liver, to image the liver all the way through, you're going to need a lower megahertz probe, probably the curvilinear. But if you're looking at the capsule of the liver, which is very superficial, you may be able to use a linear probe that has a higher frequency and ultimately gives you better detail of the capsule of the liver. It also would not be uncommon to switch transducers during an exam on the same patient just to try to image different structures better. With each type of transducer, we've talked about transducer frequencies. They come in a wide range of frequencies. Typical range is anywhere from 1 to 15 megahertz, and as technology gets even better, we're starting to see that get up into the 18 and 20 megahertz range. A modern transducer is often multi-hertz, meaning it operates at a range of frequencies called broadband imaging. So a certain transducer may have a range of 3 to 6 megahertz, and you can actually adjust that on the machine depending on your patient or other imaging factors. The narrower the bandwidth, then the more exact the frequency. A higher bandwidth will be a wider range of frequencies. So with transducer frequency and resolution, there's always going to be a trade-off. If you have a high frequency transducer, you'll have great resolution for imaging, but poor penetration. So that's going to be great for superficial structures. You can get a lot of detail, but you don't necessarily need the penetration like you would for imaging a liver. When you're imaging a liver, you'll need a low frequency transducer in order to have that penetration, but in turn, you end up with poorer resolution. So again, there's always a trade-off with each transducer type with resolution and frequency. And again, you may need to use more than one transducer to complete a single examination. That would not be uncommon. Transducers should be handled very carefully because they are susceptible to damage. Transducers cost anywhere in the range from $8,000 to $20,000, so they are not cheap. Transducers should never be dropped or banged on other equipment. You have to be very careful with draping the cords and making sure the transducers are very secure on the machine. Any chips and cracks in the housing or the casing of the transducer could harm the patient or even lead to crystal damage. Transducers should be cleaned before and after each patient. Disease can easily be transmitted from one patient to another if the transducer isn't clean and it's left dirty. Excess gel should be removed from the transducer prior to cleaning, And then you'll use a manufacturer recommended cleaning solution. This is typically in the form of a wipe or a spray that you're going to use to clean the transducer and disinfect it. You may come across a Trophon machine when you're in the clinical setting. This is a high disinfectant solution for ultrasound probes. When cleaning transducers, you should never completely submerge the entire transducer and cable in any sort of water or solution. These have electrical parts that can be damaged by submerging it. Never autoclave the transducer. This can actually ruin the crystals. And if there's ever a possibility of contaminating the transducer, you'll want to make sure you use a probe cover. So for any intracavitary type of exams, if a patient has like an open wound or sore, you'll want to make sure that you use a probe cover so that way you're not getting the probe contaminated. If you're ever questioning, it never hurts just to throw a probe cover on the transducer to be safe. Cords should be checked daily for cracks and fraying, which could cause potential harm to the operator and patient. Remember, this has electrical voltage going through the probe, and we need to make sure that the casing does not have any cracks or any damage to it. Cords should be kept straight and not caught in the wheels of equipment or run over. Make sure that you're straightening out the cords and securing those probes nicely onto the machine. And cords should never be pulled to unplug the equipment. Again, the equipment is very expensive and we want it to last for years to come. So always make sure that you're taking good care of the ultrasound machine itself and especially the transducers.